This is the kind of 20th century view. Autism is a rare and severe neurodevelopmental disorder, usually associated with intellectual disability and delayed language development, and categorically distinct from normal development and from other disorders. So, I think one of the myths that idea is founded on is that autism is rare. Yeah? So certainly, when people did the first epidemiological studies on autism, when Lotta went out into a county called Middlesex, which is the sort of county that London is in, and attempted to find all the cases of this intriguing new condition that this Baltimore-based psychiatrist Kanner had identified, Lotta and colleagues came back with his estimate that this was a vanishingly rare condition, that there were maybe 3-4 cases per 10,000 kids. Yeah? And that's represented here. And generally, that consensus held for quite a while, right into the 90s, where epidemiologists would go out, they'd try and estimate the prevalence of autism, and they'd come back with this answer that this was a rare condition that affected just a handful of young people per 10,000 and was generally a sort of severe and rare disorder. And then suddenly something changes in the 90s. And Gilly Baird, a paediatrician, again doing work in the sort of orbit of London, comes back and says, no, hang on a minute, we're not talking 10 per 10,000, we're talking 60 per 10,000. Bertram almost immediately trumps that and says, no, actually it's 65 per 10,000. So Baird hits back in 2006 and says, no, hang on a minute, we're talking 116 cases per 10,000. And now we see these estimates coming out of the CDC, which is sort of saying we're pushing really about 1.5%, 150 per 10,000. Now, we could probably spend the next 2 days talking about this slide and what it all means. And, you know, are we in an epidemic for autism? I think almost certainly not. Are we in an epidemic of discovery for autism? Almost certainly. But nevertheless, as it's conceptualized and diagnosed today, autism is not a rare condition. Myth number 2, most people with autism have a learning disability. Well, actually, again, by current contemporary diagnostic practices, we find at least half of those who meet diagnostic criteria, and actually more like sort of 70%, have an IQ in the normal range, have an IQ above 70, and have sort of fluent language. And certainly in the UK and in America, 70% of autistic kids are in mainstream school. So this idea of the autistic child as somebody who hasn't developed speech by the age of 5, who has an IQ of 50, who treats people like objects, is not really, in my opinion, generalizable in any helpful way to all autistic people. And I think that's a stereotype I would come across right when I started in 2000. You know, you'd meet the odd person who'd been refused a referral for an assessment because he could talk, you know, or something like that. I think that's become much, much less common now, and I think the message has got out there that lots of people, autistic people, in fact the majority, have IQs in a normal range. It's kind of interesting. I find this a very interesting study to link this point and the point I made on the last slide about rising prevalence. So this is a study that shows the administrative prevalence of autism in California from 1990 to 2002. So during this really interesting time when the epidemiological estimates really started to balloon for autism. And what they've done is they've plotted rates for kids with so-called low-functioning autism. It's not a term that I'd like to use, but I think I'm going to use it as a convenient shorthand, and the authors used it. And then rates for so-called high-functioning autism, which means people who are autistic but who have an IQ in a normal range. And you can see, can't you, what's, certainly at least in California, and I suspect this is generalizable, what's driving this increase in prevalence. Many, many more kids. And in fact, actually, if you look at the CDC figures, my sense is that a lot of this increase in diagnosis of autism has been driven by the diagnosis of boys in mainstream education, is my sense. But that's something we're going to come back to. And so that kind of links to myth number 3, which is that autism is just about having difficulty. So again, there's a very lively discourse about this we're certainly within the autism community, but also between autistic people and researchers, clinicians, their parents, about whether we should talk about autism spectrum disorder. And it's a term that I try and avoid, not because I'm trying to deny the fact that autistic people do experience difficulties in their daily life that stem from their neurodevelopment, but because I think the use of the word disorder is unhelpful in presupposing that this is fundamentally a kind of disordered state of mental being. And actually, I think it's much more helpful to think about autism as a type of neurodiversity that can bring with it difficulties, especially in a world where most people aren't autistic, but also brings with it strengths. And these are just some examples from the literature of studies where autistic people have been found to perform in a way that's superior to non-autistic people. And it's kind of intriguing. I think as researchers, I think a lot of us are so trained into just anticipating that when you're studying autistic people, you're looking for deficits and things they can't do so well. I think we will see a growth in the literature in the next 10 years of people being a bit more open-minded and being able to look for a more balanced picture of autism and of the capacities of autistic people. And this slide here shows people who either are diagnosed autistic or are sort of widely thought on the basis of historical accounts to meet our current criteria for autism, who have made wonderful and fundamental contributions to our culture and to our lives and to our understanding of the universe and so on. And the point I want to make here is that they didn't do that in spite of their autism. They did it partly because of their autism. There were certain ways in which seeing things differently, being different in the world, actually made insights and behaviors accessible to them that would not have been accessible to so-called neurotypical people. So myth number 4 is that autism is a categorical disorder. So I think this was a broad assumption across all of mental health thinking, which was that when we had sort of mental health conditions, be it depression or be it anxiety or be it autism, that these would be categorically distinct states from, if you like, normal development and from other conditions. So a good example of a categorical condition is Down syndrome. That really is a qualitatively different developmental state from non-Down syndrome. We're not all on a Down syndrome spectrum somewhere. It's something that you have or you don't have. The evidence is accumulating that autism doesn't fit that picture, that really this is a dimensional condition. It represents the extreme, or at least in the majority of cases, represents the extreme of a trait dimension that extends right through the general population. And there is no evidence for a natural cut point between autism and just having high autistic traits. So an analogy here might be high blood pressure. We've all got a blood pressure number somewhere, but once you get to a certain point, there's been a kind of conventional decision taken that you are worthy of clinical attention. You need a label that then leads to sort of treatment and intervention. I see autism as a dimensional condition representing the extreme of a trait dimension with no natural cut point in nature between autism and non-autism. So I've tried to challenge these elements of the 20th century view that are written in red, and to arrive at this new consensus, which is that this is a relatively common neurodevelopmental condition, usually associated with normal range IQ. I don't wish to minimize the importance of understanding the needs of people who have an intellectual disability and autism, but I still think that it's usually associated with normal range IQ, that represents a form of natural human variation, bringing both challenges and strengths. Yeah? So that's the kind of position I'm coming at this from, that's kind of how I understand autism. And I guess it's important to think about how autism is something that evolves. It's not set in stone, and I hope these slides have sort of shown that. And so what we're really talking about over the next couple of days are, do we need for autism and its conceptualization to evolve further for us to incorporate the presence of gender-specific presentations in autism? So I think it's helpful to think of how autism is conceptualized as a somewhat fluid thing that is influenced both by cultural changes and also by science. It's a complex entity in that sense.